Stopping smoking is one of the best steps your patients can take to protect their health, and now there's a better way to help your patients quit. QuitWorks, a free, confidential, evidence-based service available for all Massachusetts healthcare providers.
We really do want to help people quit smoking.
With just a simple enrollment form, you can refer patients to the Mass Smokers Helpline for telephone counseling and other support to help them quit. Funded by the Massachusetts Department of Public Health and launched in 2002, QuitWorks was developed in collaboration with major health plans, physicians groups, and researchers. Best of all, studies show that telephone counseling like the Try to Stop Smokers Helpline really works.
What we know from the studies that have been done is that telephone counseling works. Quitlines like the Mass Quitline work, and they do increase the chances of cessation by 20 or 30%.
Every healthcare provider wants to encourage their patients to quit, but finding time for counseling and follow-up with patients is a challenge, until now.
The QuitWorks program is invaluable to me and to the medical group here because it provides an extension of our services to a broad number of patients who would not otherwise have access to them, both because there are a large number of smokers and because it's a free community-based service.
Using QuitWorks is easy. Healthcare providers need to speak with their patients and offer them QuitWorks services. Then, you or your staff will help your patient complete a simple enrollment form. Your office will then fax over the form to QuitWorks. QuitWorks takes it from there. Within a week, a Quitline associate will call your patient by phone, conduct a brief screening interview, and offer them up to 5 telephone counseling sessions. And QuitWorks will follow up with you to let you know if your patient was contacted, what services the patient chose, and what was the outcome of the patient's quit attempt. Your patients can talk with English or Spanish-speaking specialists. Their Quitline specialist will also mail a free informational packet to get them started. If your patient signs up for counseling, a Quitline specialist will help him or her set goals. They'll talk about how best to deal with the challenges that come with trying to quit, and they'll be able to get the latest information about stop smoking medicines. If your patients have further questions about stop smoking medications, or if they need a prescription, they'll be asked to follow up with you.
We try to teach them that indeed quitting is possible, and what we know to be effective is a combination of quit smoking medication and some form of support, like calling the Quitline.
After the first call, all follow-up calls with Quitline specialists are scheduled right before and after a quit date that each smoker chooses for their lifestyle and circumstances.
Okay, so what's a good time for you on Friday?
Every Quitline specialist is trained to provide information and support if a client faces challenges adapting to a tobacco-free life.
To know that that call is going to come and that you're not alone in what you're doing, that to me is the benefit of the Quitline.
If you have a patient who feels the time is right to make a quit attempt, you'll want to give them every chance to succeed. Let QuitWorks help you to help them. It's free, confidential, easy, and effective. You can start using QuitWorks today. Go to quitworks.org to download the enrollment form or contact us by email or phone and request help with getting started. The time to quit is now. Enroll your patients in QuitWorks.